talked about toys earlier. We haven't shared our toys yet. We're not going to show all of them. We're going to show
Which
one
one?
each. You show yours, I'll show mine.
We're bringing healthy back. Them other bros don't know about the facts.
Hello, everybody, and welcome to the Magic of Metabolic Health podcast, episode 18, where optimized metabolic health is our goal, and we are here to get you there. Hello, Dr. Funmmy. Nice to see you.
Nice to see you too, Amelia. I've missed you so much. How have you been?
I've been fabulous, transitioning into fall, which is a little hard for me because I'm a summer baby, I'm a water baby, I'm a beach baby. You know how it is.
100% people, girl. 1,000%.
Yeah, right? I know you just go to the beach at all times, and I try. I'm getting better. Although I do live on an island, so I can't really complain. It's not like a warm beach most of the year.
This is where you are. I want to be like you when I grow up.
Live on an island? Wait, don't you live in Manhattan?
I do. Oh my God, we're still doing the same thing. I love that for us.
We are each other. We already made it. Okay, so let's get this started. Hi, everybody. My name is Amelia Wood. I am a food first personal trainer and metabolic health coach. Here at the Magic of Metabolic Health, we are building a village that encompasses every part of who you are. We release guilt and shame in the quest for perfection and show you how self-efficacy and knowing your why are crucial tools in sustainable behavior change and, of course, optimizing your metabolic health. So today, Dr. Fummy's back in the office, and she's going to lead us on an epic journey. Tell us all about it.
I am so excited, guys. This is my favorite topic of all. This is the sex episode 18, where we talk about sex, hormones, and optimizing your metabolic health, what I consider the ultimate health trifecta. So let's get into it. Yeah? So what if I told you that your sex life could predict your metabolic health? What would you say to that?
Oh, wow. That's a big statement, doctor. If I think about my sex life across the span of my adulthood, I definitely had some challenges, and I do remember one time when I had chronic adrenal fatigue, I had zero sex drive, zero libido.
Sure. Of course. So I'm going to put a pin in that one because I want to come back to that story, because you would be surprised how often adrenal crises, adrenal fatigue can lead to no sex drive. And it all comes back to this hormone we call DHEA. So when I talk about your sex life predicting your metabolic health life, the thing is that sex is something that brought every single person on the planet to the planet, right? We have sex in order for us to copulate, to reproduce, and to bring more people to the planet. So everybody knows what sex is. But are we doing it well? Are we doing optimizing it? Is it the best sex that we could have? Are we having healthy sex? Are we healthy enough to have sex? And so that is what this entire episode is about. And so when your sex life is impacted, it should be a clear red signal that I might not be optimized metabolically. And so if you're having sex challenges, you're having sexual dysfunction, it's essentially a green light to say, I should start looking into my metabolic health life because something's not clicking. It's not giving, So that's what we want to talk about today. And the only reason
can I just say real quick, and for the listeners or viewers, we're talking about men and women. We're talking about everybody.
Oh yeah, this is not just one or the other. Absolutely.
Sometimes, we were talking earlier about how sometimes the term sexual dysfunction just gets thrown on men as like a men's issue. But I think it's really important that everybody knows that we're talking about everybody, all y'all today.
This is important to mention, and I'm glad that you actually made that, the differentiation, because quite often I have my female patients come into the clinic and they'll say, well, Doc, I just don't even have like a sexual like desire. As in, I don't find like men attractive, or I don't find women attractive, or whatever you identify as. I just don't find other people attractive. Am I asexual? That's 100% a different conversation right there. But if you've historically found the opposite sex or any sex attractive, and you're no longer finding anybody attractive, that's a red flag. And so this is why we want to say is that, for the most part, when you come into the hospital or you come into the clinic and you're not feeling well, you have chronic conditions, newly diagnosed with new diagnoses or new conditions, it could very well affect your sex life. So we're trying to make the point is that your sex life is affected by your hormones, and your hormones are affecting your metabolic health life. Your metabolic health life affects your sex life. It's just all one giant triangle of trying to figure out what is the issue here and how can I optimize it. Yeah?
Yeah, that makes sense. I'm on board. Tell me more.
All right. So most of the things that I see in the clinic are, like I said, a lot of the reasons that men come into the clinic, it won't because their foot just got amputated. It won't be because they just lost their job. A lot of it will just be like, my penis stopped working. Doc, help me. So a lot of the reasons that men come into the clinic will be like sexual dysfunction, erectile dysfunction, that kind of thing. Women will come into the clinic if their menstrual cycle gets messed up. Let's say that they're a premenopausal woman and their menstrual cycle went from 4 weeks, which is supposed to be the norm, and now they're only seeing it every other month or every couple of months, and then they bleed for 2 weeks, so they know that something is amiss. And so the reasons why different genders come into the clinic to kind of optimize their metabolic health is completely different. And so now that we're here, we're saying, okay, what is affecting my sex life? How can I make it better? And that's what we're going to talk about today.
Yes. And just in case people didn't see the episode we did a few back, it was episode 10 called the Man episode. And we dove pretty deep into details around metabolic health and men, and some of the stuff, Funmmy, that you're talking about was covered. And so if you want to get more information about men's sexual health and other hormonal issues, please watch that episode 10. It's great. It's pretty long. It's an hour and a half. It's full of a ton of information.
A ton of stuff. Yeah. But then we also had a women's episode where we were talking about women's de-stress and how stress does in fact affect your libido, affects your metabolic health, affects you as a woman. And so what episode was that?
That was episode 14, called Rest is Blessed, Women's Stress. And we focus on some main tips to better manage metabolic health for women.
I like those episodes. Those episodes were so fun to do. And so I can't imagine why this episode won't be just as fun to do also. So honestly, I think the reason why I even like this conversation so much is because before medical school, before residency, before all of that, I was a baby intern at the Kenzie Institute of Sex and Reproduction, and that is in Bloomington, Indiana. And so I was already doing sex research at the tender, like as a baby intern, like, because I thought it was so interesting. I think the reasons, why people pursue sex and the type of sex they have and the barriers to sex was very important. And so I've always been interested in this, and I don't know. As in, it could be why I have so much to say about it. That being said, now that we're here and I have the medical knowledge after going through residency to understand what are the pharmacodynamics, what are the feedback mechanisms, what are the hormone loops that's happening in our body that affects our sex drive, and how can they go down in order to, kind of ruin our sex life. So here it is. The thing is that we talk about hormones all the time. I don't think a single person hasn't heard about testosterone or estrogen. We think of testosterone as the male hormone. We think of estrogen as the female hormone, but it couldn't be farther from the truth. Every person on the planet has some levels of testosterone, some levels of estrogen, but men tend to make more testosterone. And testosterone is a hormone think about it as the sex hormone, the libido hormone, the hormone drive, the hormone that makes you go out there and want to have sex, right? So women make testosterone too, but not to the levels of men, not even close. I believe it's like 17 times more than women. So men are making an enormous amount of testosterone, and that could explain why men are culturally known to be the pursuers of sex, the ones that are seeking out sex on a day-to-day basis, versus women who also have testosterone. We can also have a libido, but it's just not as high as men. We're known to have more estrogen. Estrogen being the hormone that essentially is the one that makes us be reproducing creatures. We have uteruses, we have vaginas, we make people. So we have a way more estrogen than men. So why is this important? The reason this is important is that when those levels get skewed in people, you're going to have a very different sexual dynamic. You're going to maybe have sexual dysfunction. So when men's testosterone is very low, and we're talking about less than maybe 300, this is going to cause sexual dysfunction in them. They might not be able to maintain an erection or even have stamina to have sex. Their sexual lives are going to be completely different than what it used to be. And that could cause depression. That could cause issues. Same thing with women. When the very little testosterone that we do make, if that's even lower, then you might find a woman that has absolutely no appetite for sex whatsoever. And so, or if their estrogen is far greater than testosterone, then that balance, that ratio is so skewed that you're going to have some sexual dysfunction, some no sexual appetite whatsoever. So we got to talk about these hormonal changes that causes this.
Yeah. So the first thing I think of about when it comes to metabolic health and hormones. Now, I might be going off course here because I know you just said testosterone and estrogen, but as a personal trainer and metabolic health coach, one of the main hormones we talk about is insulin. And I'm curious. I'm curious to see if that's going to come up in what you got to say right now. I just wanted to bring it up. And,
here's the thing. So here's how I like to think of insulin when I think about in relations to hormones. Let's say that you're someone that has diabetes. So you have a fairly high degree of insulin resistance. And we've already talked about what insulin resistance is, but let's bring it back. Insulin resistance is that when your cells don't see insulin, your pancreas exudes insulin in order for you to metabolize the sugar that's in your system. If you have diabetes or maybe a very high fat content in your body, your cells maybe become insulin resistant. So that means it doesn't see the insulin when it's circulating in your blood system. So the problem with that is that when your cells are blind to insulin, it's also blind to other hormones like testosterone, like estrogen. You can't bring your hormones into the cells. So your body's exuding all this hormone, but it's not working on the cells. So it's almost as if you don't have low T, you don't have low estrogen, you have a normal amount of hormone, but because your body has the inability to see it, it might as well be as if you don't have it. You might as well not even have it.
That makes sense. Yeah, that makes sense. Man, the more I study about insulin resistance and prediabetes and chronic inflammation and stuff, insulin is like the hormone that I always ask my clients to get tested, a fasting insulin test, which I'm learning is not common. Doctors generally don't do it because is that true? Like in your own experience, were you taught to test for insulin, or was it more just fasting blood sugar and A1C?
So that's the thing about it. You won't typically just go and test for insulin because there's other so when we're testing a person and we're concerned that they may have insulin resistance, first and foremost, that's not something a doctor is immediately looking for. What they're looking for are the smoking gun, the diagnosis, which is, does this person have diabetes? Does this person have dyslipidemia? Does this person have heart disease? So they're looking for the smoking gun diagnosis. What you're not trained as, if you're not a metabolic doctor, is to understand that insulin resistance is what leads to the smoking gun diagnoses.
Exactly.
So it's a missing piece, right? So it's very interesting. Thank you for mentioning that. But yeah, so what it is that what we're looking for is like, okay, when we look at the fasting glucose leads to the smoking gun diagnosis of diabetes. What you won't think of is that the insulin resistance is what led to the diabetes, which is the smoking gun. So you're missing that crucial step. So if you look for insulin resistance, you're going to find all the issues. You're going to find the metabolic health. You're going to find your sex life, in the dumpster. You're going to find the heart disease. You're going to find the diabetes. You're going to find the cholesterol. You're going to find all of that because it all links back to insulin resistance. And so that was great, Amelia, as in, yes, it's essentially what it is, right? But then we're also thinking about things like other hormones that come into play, like cortisol, right? We know that cortisol is a stress hormone. When your cortisol is very high, all it does is that it's the stress hormone so when I think of cortisol, I think of like a bully that just goes through the system and wreaks havoc on everything. When that hormone is very high, it tears down everything, tears down your arteries, your vessels, it punches out like different organs. And the first thing it does is shut down your sexual desire. When you're stressed, you're not horny. And most women can you talk to most women, the last thing that they're thinking of when they're super stressed is, let me go and get laid. It is literally the last thing in the world. Men are a little different because you could still be a highly stressed man and still desire to have sex, because sex is a stress relieving thing for men. So therefore, you could still be you could be in a high stress situation. Your cortisol could be very high and you would still desire to have sex, is because your stress would be reduced by having sex as a man, usually. But women are a little different because our testosterone is not that high, right? So we're not thinking, let me go and have sex in this stressful environment. It's almost completely the opposite with women. Women require a safe, comfortable, stress-free environment to really be their most sexual selves. That is when our testosterone goes up. Mm-hmm. And so that's why sometimes and I feel like sometimes as a physician, you end up becoming like a couples therapist, because your couple will come in and they'll be like, yeah, things are not really great. Right now we're financially struggling and, XYZ. And maybe the man is a little bit more desiring of sex, and the woman is like, that is the last thing I want to do. And it's literally what we just talked about, which is that in a stressful environment, when the cortisol is up, men might still desire to have sex, and women, that has completely shut down. And now you have an extra problem in the couple, because now they're financially stressed and they're sexually stressed because of just that divide, that big difference between two genders. What can you do to that?
So this brings me back to what I mentioned earlier. And I if this is not the time you wanted to jump back to it, let me know. But the whole adrenal fatigue story that I've shared before in other episodes. Mm-hmm. But when my libido dropped was in a very stressful time in my life, personally and professionally. But what I discovered through my lab test is that my cortisol tanked. I had 0. And my naturopath at the time was like, I don't even know how you're functioning. I could barely eat or digest my food. I tried to work out. It didn't help. It put more stress on my hormones. And I ended up having to take a bunch of supplements. But ultimately, she's like, you got to change your life. I can't fix any of this chronic, very low, abnormal cortisol problem with anything. The stress is going to fix it. Getting rid of the stress, minimizing the stress.
Right.
So I just wanted to offer that sort of polar opposite experience, because women so often get labeled with, oh, you have high cortisol when you're stressed. Well, my body reacted a little bit differently. So
no. And most definitely, you have to remember that cortisol it's not all bad with cortisol after all. Cortisol is a hormone that actually, like you said, it causes you to increase your blood pressure. As in, you need cortisol. That stress hormone, your body needs stress in order for it to function. You need some cortisol, but you also can't have too high a cortisol. It's a range. So you can't have nothing because your body won't function. But then when you have too much, your body won't function. So it is definitely a range with most people. Cortisol spikes at night. What we're trying to do is make sure is that you have a normal level. When your levels are not normal, you can't function as a person. And cortisol affects absolutely everything in your body. And so, like I said, it's still important when you're kind of going through an endocrine fluctuations that you're concerned, you want to go to your doctor, having those levels tested, because your presentation can be different between having very high cortisol, having low cortisol. You need to know what type you're dealing with. You need to know what type you're dealing with. And so not everybody has just no cortisol whatsoever. Some people have the super high one, but it's essentially guesswork if you don't go and get it tested, know what your levels are, and see maybe an endocrinologist to be able to suss out what exactly the issue is and what supplements you'll need to get you back, whether it's bringing down your cortisol or actually just resetting your adrenal gland to be able to produce cortisol. So that in and of itself, very special, very, very special,
sure.
situations.
I also want to throw out, and we'll put a link in the show notes, how to get the most accurate cortisol test results, because you can get a blood test, which allopathic doctors, like in institutions where you work, Funmmy, that's the blood test that you have your patients take. But unfortunately, it's only one moment in time that it's measuring your cortisol. And like you said, our cortisol fluctuates throughout the day. Sure. And I think you might have misspoke. Did you say, I think you said the cortisol spikes at night? It actually is supposed to spike in the morning, right?
Right.
Yeah.
So first thing in the morning as you're waking up. So your cortisol spikes to wake you up. And
right.
so
if you're getting...
that's why adequate sleep is so important. So when you have adequate sleep, your body is essentially like filtering through all of your hormones and resetting them and gathering them. So sleep is an active process. When you're sleeping, your body is doing a lot of scavenging work, a lot of repairing work, that kind of thing. And then your cortisol spikes first thing in the morning to wake you up. That's why I said that cortisol is very important, just to get you going. So if you don't have enough cortisol in your system, you're not even going to wake up. You're not going to be able to feel the energy to do the things. You're not going to feel a desire to even work, to have sex, to do anything. So cortisol is actually one of my favorite hormones.
For sure. I mean, with my kind of traumatic experience of my cortisol tanking, I very much value it. And that's why I want to bring up resources for people to get different tests, because the blood test is only one point in time, but you can get a kit. It's a saliva test kit. And I believe they give you 4 vials, and you test at 4 different times during the day to see when your cortisol is like normal or, optimal. And when, like Funmmy said, you said that it needs to spike in the morning, but if you get tested at 1 o'clock in the afternoon at the doctor's office, it's not going to help you know if your cortisol is at the optimal level in the morning or not. So doing these 4 saliva tests helps you see whether or not you have that bell curve. And it's really, really insightful. It was very helpful for me. Unfortunately, my cortisol was like this.
No, honestly, I'm actually glad that you've actually experienced some of this personally. Not glad that you experienced it, but glad that you could be able to lend your toolbox of resources to help people, because there's so many people who are actually really going through this, and they're going to the doctors and they're not really understanding what's going on with them, and not knowing that maybe seeing an endocrinologist or that will be able to really help them suss out what exactly going on might be the best move for them. So yeah, I'm glad that we're talking about this. The only thing is that, like I said, when we're talking about hormones do also change as you age. And so you might find that a lot of women, their testosterone starts to peak later on in life. And that's just good because their estrogen is starting to go down as they age, right? And so as women get closer to premenopausal age, their testosterone is going to actually become a lot higher than their, estrogen has ever been. And so you might find that you'll see a lot of older women that'll say that, yeah, my libido is the best, as in now my sex drive is super high, versus my husband or my partner who their testosterone is now becoming lower as they're aging, right? And so you'll find, and that could be a very interesting dynamic with a lot of couples. Same thing when, men, as they're getting older, it's very jarring for them to have this very high sex drive in their 20s, and at the age of 30 your testosterone starts to dip, and you'll find that your sex drive might not be as high, your stamina might not be there, you're aging, And having that conversation with my patients that, hey, by the way, are you aware that you're getting older and your hormones are changing? And so you will also change as your hormones change. So that can be very jarring conversations to have with people, but it's a conversation that has to be had.
100%. Yeah, and we definitely want to encourage healthy dialogue here on the Magic of Metabolic Health podcast and with the listeners, right? And so there's a question we came up with, and put it in the show in the comments below. One question we came up with is, if you care to share, what dynamic of your sex life has been the most challenging for you, either recently, currently, or even in the past? Like mine was 15, 17 years ago. No, it was 14 years ago. Anyway, but yeah, please share in the comments what dynamic of your sex life has been most challenging for you, because I bet, and I know Funmmy, you would bet too, that if we had a magic wand into the past, or magic goggles into the past, we could probably find some kind of metabolic dysfunction that was not just stress or circumstance, but, you know, and now if you have a current issue, we'll talk probably later about more tests that you can do to check if you're having issues right now in the bedroom. So please share. Anyway, we wanted to ask that question.
Yeah, let us know, because you'd be surprised how often someone is having like a very challenging sexual life, and they don't understand, is it me? They're kind of like already beating themselves up as like, it must be something that I'm doing, as in I'm not. And then having a challenging sex life or not an optimal sex life, it ends up like, taking a toll on your self-esteem. It must be something I'm doing. There's something wrong with me. Well, it's not that there's not something wrong with you, but it just might be that your hormones need to be optimized in order for you to actually have that drive, have that stamina, have that want, have that need, have the body that can be able to successfully have great sex. And so having that conversation is super important. And let's have that conversation today.
Yeah. And as a food first personal trainer, you know that I'm not an endocrinologist, but if there's energy issue, like energy output issue with a client of mine, I'm going to ask, what are you eating?
Sure.
What do you eat in the morning, afternoon, evening? What are you drinking? Because as, metabolic health enthusiasts, right, and advocates, Funmmy and I understand that there's never one quick fix or a best Band-Aid approach to metabolic health. And food is medicine. Food can make you or break you. And if you're feeling a little bit run down, I'm going to always encourage you to reevaluate or sit down and start to evaluate what you're putting in your body. So
I like that. Honestly, it's a trifecta of things, because I feel like we deal with a lot of trifectas. We're dealing with the sex, hormone, metabolic health trifecta. But then we're also talking about the fact that your sleep quality, your sex quality is very much affected by your sleep. Is very much affected by your stress. Is very much affected by your intake. And that's not just your food intake, your consumption in general, social media intake, the conversations that you have, your workplace environment, your home environments. If those are not optimized, then your sex life is going to suffer. Yes, if you are not having proper sleep, then your hormones are not being scavenged at night. Your hormones are kind of maybe out of whack. If you live in or working in a very stressful environment, your cortisol will be high. Your stress hormones is kind of, once again, it's going to be high. It's going to be wreaking havoc on your body. If what's the last one that I said? If your consumption is poor, for example, right now we're dealing like with the biggest porn issue in the country right now. As in, right now, the amount of porn that is being consumed in the country is affecting the sex lives of men and women. And when we kind of consume porn in this kind of in a unrealistic scope of how sex should be with a person that you're actually about to engage into sex with, then you're going to have poor expectations of what that sex should be like, because porn is not real, right? As in, porn is a performance, it's entertainment. very, very rarely is your the porn that you're consuming going to be like the porn that like the sex that you're having in your day-to-day life. And so that mismanage of expectations when it comes to sex could very much ruin your sex life in general. And so we got to talk, as in, I don't think people are really thinking about it in that way. It's just something that you're doing because you want to have sexual gratification, which is your right. But holding it to the same metric as the sex that you have in your day to day will ruin sex for you. 1,000%.
Yeah,
1,000.
I have seen commercials or advertisements, for this issue, and I haven't really looked into the resources, but I definitely want to do that for our listeners, and I'll be sure to put a link in the show notes for support. Like if maybe you have a porn addiction, you don't even know it. Maybe what you were saying, Funmmy, about like expectations, maybe your expectations have been formed by certain things you've seen, even in the movies, So I'm gonna do some research and find some good support links that we can share with everybody later.
That'd be dope. Listen, I'm gonna see if I can actually find some sociological links and cases about that so we can add into the show's notes. But I think also it's just about like even our celebrities and like not just celebrities, but our heroes are dealing with like a lot of these type of sex issues. And so if it can happen to someone that is who looks physically fit, but they're having issues in their own relationships, then it can happen to you. So I think that having that clear understanding and clear conversation and like talking about it would be the hugest difference. When we're talking about sexual activity, we have to remember that sexual activity is a form of physical activity, and so if you can't do physical activity, can you do sexual activity? Do you know what I mean?
Yeah, I mean, physical activity has a large spectrum, right, of options. And
Amelia, what do you mean? What do you mean by that, Amelia?
Well, I mean, it could be applied to sex. There's a large, long.
Amelia!
I can't stop. I'm not trying to be punny. I'm not trying. But okay, let's just say there's a rainbow of options in your life to be physically active. Same with sexually active. We all have our preferences. And
Sure.
I always say with my clients, if your MO is to move more, right? And you hate running, and then you start running, number one, why? Number two, how long do you think that's going to last? A day? 20 minutes? Not 6 months, not a year, not 10 years, most likely. If you're hating the thing that you're doing, or it makes you uncomfortable, or you're really bad at it and you have no desire to improve at it, then you got to reconsider and think, well, what do I want to do to move more? What am I attracted to doing? And I was just talking with a client the other day about how she hates working out. Like she hates the term exercise. And I said, well, what do you like? And she goes, I really like walking. And I'm like,
Then just do
bam,
that.
there you go. We got to start small. Okay. We're not trying to get to, Schwarzenegger level in 6 weeks or anything. And some people could care less about that. She's like, I want to build muscle because I want to be healthier. I want to lose fat and I want to have better mobility, better flexibility. And she's older. She's like, and I don't want to fall and break my hip. So the muscle part for her, it was her own reasoning, right? With her own objectives. And I think that's really important when we talk about physical activity and also sexual activity. What do you like?
As in, doing what you like is really important. I'm not here to yuck anybody's yum. If you want to do whatever you want in your sexual life and you want to be able to have the heart to do it. And by the heart, I'm not just talking about the willingness. I'm talking about, can your heart tolerate sexual activity? If you, can you walk 20 minutes and not feel short of breath? Can you run for a mile? Are you able to, do you still have your flexibility? Are you able to, like, can you tolerate the sex that you're trying to have? And I think that's important to say, only because when you're having sexual activities, actually, it's essentially a form of hit, right? We're having short bursts of elevated heart rate. Your sympathetic nervous system is activated, and then you're forever, however long that you're doing it, and then hopefully it ends in orgasm and some type of achievement, a high five, I don't know, and then you know, I'm hoping that this is how people's sex life is going. And if it's not, it's time to, like, look at a change and see what is it about my life that I can optimize to make my sex life better. And also let's talk about like vascularity. The fact of the matter is that when your body is an organ, and so blood flow is where you're going to have the most blood flow is what your heart is doing when your heart is beating fast, right? So you're getting the blood to those organs. So if your blood flow is compromised, then you're not going to have good blood flow in that area. So we're talking about people with hypertension. Talking about people who maybe have a larger body mass. And you have to remember that when you have a larger body mass, your body needs more vessels to be able to go into your organs. And so when you gain weight, when you're obese, when you have high blood pressure, when you have diabetes, which affects the blood vessels in a different way, your sex life is going to be compromised. And this is why we talk about chronic diseases affecting your metabolic health or your sexual health. Yes, it affects your sexual health. And so when you reverse those things, when you keep your blood pressure in line, when you keep your sugars in line, when you actively do physical activity, when you walk, when you stretch, when you do those things, you improve your sexual life. Yes, it's a direct link.
Yeah, for sure. I really like that you brought up blood flow.
Mm-hmm.
We talk about circulation in training, right? In personal training.
Sure.
And one of the things that comes up with not always my older clients, but generally is neuropathy.
Sure.
And neuropathy in their hands, fingertips,
Yeah,
feet,
absolutely.
where basically, it feels like pins and needles, or there's numbness.
Sure.
And I think about people who've lost limbs, their foot
Sure.
or their toe due to lack of circulation and chronic inflammation, right?
Sure.
And so you might not think that circulation has anything to do with your quality of sex life, but clearly, the more Dr. Funmmy talks and the more I'm like thinking about it, it's very much connected. And maybe we can find some kind of resource too to put in the show notes around, I don't know, improving circulation. Besides, like, obviously moving your body.
Circulation is there. And so, honestly, it's a very interesting topic because sometimes when we talk about circulation, we talk about the fact that you can't feel certain things, right? So, the pins and needles in the hands and feet is like, classic diabetes symptom that we often see. Sometimes it could be a vitamin deficiency. Sometimes it could be a lot of different things. But then let's talk about the opposite, not feeling things. So when your diabetes or is really that bad, you get to a place where you actually have the neuropathy that you can't feel things. And so this is when we do the feet exams for diabetics, because they can step on things like pins and needles, nails, and they won't feel it because they've essentially lost the sensation. That happens also in the pelvis area. And so you often see people that have like neurogenic bladder, autonomic dysfunction. So their peeing is affected, their genitalia is affected, all those areas are affected. So it's just bigger than what we even know. It's big, like sexual dysfunction, and it's bigger than what we even can even imagine, and it's all driven by some of the chronic diseases that has affected our nerves, our arteries, and our ability to feel, our circulation, and our sensation in general. And so thinking about that as a whole topic will bring it in for you, because you're like, I wonder if my chronic disease is affecting my sexual health. I wonder if that is why I'm having this is why I'm struggling with it compared to when I was younger and I didn't have this diagnosis. Yeah, absolutely. But you know what's the one that we never think about? Our drugs. the drugs that you're taking. The
Oh,
drugs that you're taking that is
prescription
affecting
meds.
your libido.
Are
Yeah,
you
the
talking about
prescription.
prescription meds or street drugs, like recreational?
No, I'm never talking about street drugs. Not that I don't care, but I don't care.
Yeah,
The
we'll
fact of the
stay
matter is that
focused on the
let's
pharmaceuticals.
let's stay focused, because a lot of my patients will be like, "Yeah, I smoke marijuana occasionally," or "Yes, I do Molly or at a rave," or "Yes, I do cocaine with my friends in Vegas." Yeah, yes, this is problematic as a physician, because I'm gonna have to tell you, hey, don't do street drugs. They're not good for you. Yes, I will say that. I am more concerned about your diabetes and your hypertension and your chronic diseases wreaking havoc on your system in a systematic, progressive way that completely shuts down your system. And so, not that, once again, don't do drugs, kids and adults. However, I'm more concerned with, you know, we got a little bigger fish to fry when it comes to that. Okay.
Yeah,
Um,
right. If you're prescribed a prescription, you're
yes.
told to take it once a day, twice a day, 5 times a day, depending on what it is. And we know from the commercials we watch just a tiny bit of the potential side effects, including death and terrible things. Yet
Okay.
we're still taking them. So, not to
All right.
judge.
All right.
Sometimes we need
All
that
right.
little
Hold on a
support
second.
of
Hold
a medic. Okay, I'll stop.
on.
Go ahead,
Hold
doctor.
on a second. Wait a second. I'll hold on a second. I'm not even worried about the 0.01% of the populations that have a side effect like, you know, psychosis or like, that kind of thing. I'm talking about known side effects of drugs like, let's say, SSRIs. What, like, SSRIs are antidepressants, and we know that a good percent of the population are on antidepressants, but we also know that a good percent of the population are also suffering from the side effect of that drug, like sexual dysfunction. And so, what are SSRIs? SSRIs are essentially selective serotonin reuptake inhibitors. And so, what does that mean? It just means that it's a drug that prevents the serotonin from being reabsorbed in your system. So, when your body releases serotonin, there's a mechanism to reabsorb the extra ones. The drug essentially prevents that mechanism from happening to flood your system with serotonin. Now, when your system is flooded with serotonin, you feel better. Sure, because now you have this hormone that essentially reduces your stress, affects your thyroid, affects your metabolism. But then the side effect of that, it can kind of reduce your libido because it reduces your testosterone, it increases your estrogen. It might affect that ratio a little bit. So you have a lot of people who have sexual side effects from SSRIs. Why is this important? It's important is because because your sex life is now being affected by not even chronic diseases, but by a drug that you're trying to take to keep yourself, a little bit happier, a little bit satisfied, a little bit more functional in your day-to-day life. So a lot of patients can be like, well, I'm damned if I do, I damned if I don't. There's hope. The hope is that you retrain your system. The hope is that you work on your gut microbiome. And you're like, how does my gut microbiome have anything to do with SSRIs? Because your gut is the number one producer of serotonin. We're coming back. We're bringing it back full circle. One of my favorite things to do is talking about the gut axis, connection, and about how your gut affects what you eat, what you eat produces hormones in your gut that it makes you feel a certain type of way. And so when I say that everything can be fixed with metabolic health, everything can be fixed with metabolic health. And I do mean everything.
Yes,
But
I agree. That's why it's the magic of metabolic health.
right,
It's
and not the
pure
logic
magic.
of metabolic health.
Not the logic.
The logic of metabolic health.
I mean, it is also logical, but we are
It
not
is
taught
also
logic.
logical.
We're not taught logic, are we?
We're not taught logic. What we're taught is that if you do this, then this should happen. But that's not how your body works. Your body works on negative feedback loops. Negative feedback loops like testosterone, like people who take when they're taking testosterone from the outside, your body already naturally makes testosterone. So if you're taking an enormous amount of testosterone, your body then shuts down the feedback mechanism to make testosterone. That's how the body works. It works sometimes in a We call it like a counterintuitive way. You would think, oh, I'm giving myself testosterone, body, that means that I need more testosterone, make testosterone. That's not how it works at all. That's not how it works at all. And unfortunately, that's literally what 4 years of medical school and 3 years of residency and post fellowship training will teach you, is that the body works in a very counterintuitive kind of like loops. And so in our situation, you have to figure out, where did the loop start messing up? How do you fix the loop? So we're fixing the loop by fixing our hormones. We fix the hormones, we fix our sex life. We fix the hormones, we fix our metabolic health. We fix the metabolic health, we fix the sex drive. It's one giant triangle. Like it looks like I'm doing like that thing with, yeah, I like that.
I wonder if we can find a nice diagram of that.
Yeah, I'm sure we can. Because I would like to like do this thing where we incorporate more diagrams, where we're pointing is like, look, this is what's happening here. This is why it's messing up. And here's what you got to fix. And it always goes back to the metabolic health. Mm-hmm. It always comes back to your metabolic health. You fix your metabolic health, you fix the hormones. You fix the hormones, you fix your sex drive. It's literally A plus B equals C. You would think, right?
Yep. So what else do we want to talk about regarding this trifecta? I was wondering, actually, do you have any stories, of course, anonymous, from your practice that, maybe you had a patient come in with sexual dysfunction. They clearly had insulin resistance, but then maybe they made some changes and they made improvements. Do you have any specific experience with that? Really?
1,000%. Okay, so I had a patient. Now, mind you, he's a very extreme example. But I had a patient. He was a young Black man. He weighed about 500 pounds, and 505 when we first saw him. So this was before before Wegovy and Ozempic. So we had to put him on essentially just a weight loss protocol. So we were changing his diet. We had him on a very high protein diet, not carnivore, but maybe a very high keto diet. And then we also kind of started giving him supplementation. And so he started losing weight. He lost maybe 50 pounds, which is only 10% of his weight at the time. At 10% loss of his weight, he started having morning erections. Now, why is this important? This is important is because when you get to a certain size or a certain BMI, you have to remember that, once again, when we talk about BMI, we're talking about just fat. And fat is not just stored glucose that has turned into fat and that you keep in your body. Fat gives off hormones. And the hormones that it can give off is something called estrone, which is very much like estrogen. So if you have a very high fat content in your body, especially as a male, you're giving off more estrogen than you would have maybe normally given off. And so your estrogen content is now more than your testosterone content. So you may find that your morning erections that most healthy men have first thing in the morning, that they suddenly disappear. So when you're losing weight and you regain your AM erection, that's a clear indicator that you are doing well, that you're doing better, that you're heading in the right direction. And that was at 10% of his body fat, of his body weight. So little changes can bring about big changes. You don't need to be 280 pounds and then you lose 80 pounds in order. You could lose 20 pounds and you could find a very significant difference in your life. Same thing with women. If you're very obese or you're very out of overweight, your BMI is not optimal and you want to see some changes, the difference of going for a walk around your block every night and changing your diet and dropping 10% of your body weight could be the difference of you having sexual appetite, sexual stimulation, sexual desire, and sex in general. And so, yes, we're talking about small changes having enormous changes in the grander scheme of things. Absolutely.
Right. And that's from your own professional experience. And I would love to hear from the listeners too, if you have something similar or even different to share. That actually made me think of a client I had once who considered himself overweight and wanted to lose weight or lose fat. and he shared his labs with me, and his A1C was like 4.7 or something. And stereotypically, we tend to assume that big people in bigger bodies have diabetes, like just period, or they have high A1C. And this person didn't. And so it's just interesting how there's so many nuances, and everybody's body responds differently to different conditions. So for your patient, he had one particular issue that immediately improved, pretty much. And so I'm always about nuance. I just want to make sure everybody understands that here at the podcast, Funmmy and I want to consider everybody's experiences, and we never try and overgeneralize and say, this or that only because of this or that. So anyway, I just wanted to share.
There's 8 billion people on this planet. And although we are all, although we are human, as in the things that our body express and the things that we don't express is different from person to person. There is it's not even 8 billion anymore. It's like more than that. There's more than 8 billion people on the planet, and no two human beings are the same. And even twins that are born out of the same placenta could come to this world and have a completely different biological makeup as they start to age. And certain, that's why some of them, like identical twins, could end up looking different over a span of a lifetime, because that which you put into you is just important of that which you are made of. And I'm going to say that again. That which you put into you is just as important as that which you are made of. You could have excellent genes. I'm talking about you are the creme, you are the LeBron, you're the Serena Williams of genes. And because of a poor diet and poor environment, high stress, poor diet, inflammatory diet, you've lost the lead that you're supposed to have in life. Same thing. You could have very poor genes. I'm talking about garbage genes. You probably shouldn't have, we're not even sure how you got made. And then if you put someone in that environment, I'm serious, because we got people who their genes aren't great. They got they probably have genes for schizophrenia. They got genes for all kinds of cancer syndromes, that kind of thing. But you put them into an environment where you give them the best of foods and, low stress environments where they're being optimized all the time. And you might find that in a single generation, you've eliminated those risk factors. And we call that epigenetics. We call that epigenetics because you have the very real ability to make sure that your next generation is better by literally living a good life now. I don't have children, but I could have children. And if I had children, I would imagine that I'm setting up a future for them to be better just by simply living a good life now, by making sure that what I ingest is non-inflammatory, by making sure that I'm working out, I'm making sure that I'm optimizing my metabolic health as much as possible, so that if and when I have children, they could be on the best foot forward that I could possibly do. That is what we're supposed to do. As in, you set up a college fund for your kid that you have or don't have, but you're not optimizing your metabolic health so that you can make sure that their genetics are as on point as possible. What are we doing? What are we doing here? These things are just as important. Thinking about the overall grand scheme of things,
Yep, I hear that, and I agree. We've got to look at the whole picture. I think that life is becoming a 3D process. It's multidimensional, right? We're not a beginning, middle, end line, straight line to the end. It just doesn't work like that. And so I was thinking as you were talking about steps forward. So you're talking about prevention, you're talking about optimization. So if we have folks listening right now who have questions, one, put your questions in the comments, but two, let's talk about some actionable tips. We don't give medical advice here, but we do educate you on things that can be helpful. So
absolutely.
Funmmy, what you got?
I think the most important thing, and I said it when I talked to Tony, Dr. Tony Hampton, when I was interviewing with him when I was still a resident. I said it times without numbers in this podcast, and I'll keep talking about it. The most important thing that you could do is optimizing your sleep. The most important thing that you can do is optimizing your sleep. And the reason why is because your sleep is not just some semi comatose state where you're not, where you're just not, where you're not aware that you're in the planet, you're on the planet anymore. It's not some place where you're just hibernating somewhere and that's it. No, sleep is a very active process. And so when you optimize your sleep by making sure you have deep sleep, restful sleep, and where REM sleep, your body is essentially scavenging hormones. It's scavenging the hormones that we talked about. It's you're having estrogen and testosterone spikes. You're scavenging the cholesterol and the LDL and the HDL out of your system. Your cortisol then spikes to wake you up. All of that process happens during sleep. So that process can be optimized when you have good sleep. So go back to the episode where we talked about sleep hygiene and look that up. How can I optimize my sleep so that I can make sure that I have a better sex life? You can't go rounds. You can't go rounds if you haven't had sleep. You cannot lay that down. You can't crack without sleep. I want to be quoted to say that. If you're not having good sleep, you can't crack. Yes. And Amelia.
Yeah, I can't remember how many episodes you have laid into the sleep issue.
So important. I might go back for like my fellowship in in sleep medicine. That's how much I really believe in this, because quite frankly, sleep is just so important. And I don't think that we know that much about it. We just think, oh, it's just this thing that everybody does, but it's a fourth of your life. A fourth of your life you spend, a third of your life you spend sleeping. That we should study why this is happening, why it's important. And actually, I think I read a book about this. I recently bought a book called Why We Sleep. And I'm really looking forward to kind of delving in and coming back to that about the importance of it and anything else that I don't know about it, because it's such an interesting topic to me. The second most important thing that you can do is about getting physically active. When you're physically active, when you can do physical activity, then your sex life will be better. So you should be lifting heavy. You should be doing sprints. You should have short sprints. These are the things that increase your testosterone naturally. And so this will be mostly for like our women, right? Because we already know that the testosterone may not be as much as men. But if you're a man and your testosterone is on the lower side, and once again, this is when you go to the MD, a physician, and you get your AM testosterone, and you have to do it twice, right? So you do it twice, and if you notice that you're on the lower end of the spectrum, that means your testosterone is not really optimized, and so you should also be lifting heavy, going and doing sprints, getting your testosterone to be higher. That will improve your sexual drive, your satiety. It's going to improve your overall sexual health. So yes, getting those numbers and knowing what to do. If you don't have a plan, let's make a plan for you.
Yes, and I offer one-on-one plan appointments. We can plan together virtually.
Amelia,
I did it. Well, I had someone review me on Google the other day in response to a wellness workshop that I led for event professionals. And one of the things he said in the review is that I wish I could have her once a week kind of in my back pocket to work on this stuff. And I literally responded like, actually, you can. I offer one-on-one sessions virtually. We can meet weekly if you want, in case y'all didn't know. But I was going to say all these educational tips that you're offering, Funmmy, let's make sure that we have some backing information to provide in the show notes, links for how sleep is so powerful as a healing mechanism, a healing modality, lifting heavy, sprinting short. I wonder if, what's his name from New York? He's a weightlifter. He has a 15-minute protocol. Why is his name escaping me?
We'll come. I was like, come to you like
Busikio. Anyway, It's coming. It's coming. His name is Dr. Is it Ben? I think it's Dr. Ben. I can never remember.
Have we seen him at a
Bokikio. Bokikio.
I think we saw him at a conference, like
Yes.
We did at the Society of Metabolic Health Practitioners in a conference in San Diego. I think we saw him.
Yeah,
he was
Ben's
brilliant.
awesome. I'm gonna link him. We need to have him on the show.
Let's tag him because he was wonderful. I thought he was great.
Yeah.
But yeah, as in having like a some type of protocol that you do, some type of circuit, some type of routine that you do that just gets the blood going, gets the heart beating. It's always going to be to your benefit. But then what you eat is just as important. And I think that sometimes when we talk about, okay, what do you eat? Like, we talked about, the diet, the dietary changes that you have to make, the getting rid of the inflammatory foods. But then we're also talking about like multivitamins. There's a mineral we don't talk about it often, but it's called zinc, and every man on the planet needs it for proper sperm function, for proper sexual health, vitality, and that's called zinc. And so getting your zinc levels checked, or even just incorporating zinc into your life, is going to be the difference of your sperm quality, of your just as a man. In addition, it's actually really good for your skin, and it's often, very low in patients that have diabetes, that have liver disease, that have, skin disorders and things like that. So supplementing this type of mineral is really important. But then just, making it a priority. Some people's sex type is not affected by anything that they're doing metabolically, but just because they don't have the time for it. They're working so much. Like, okay, for example, I'm a hospitalist. Girl, I work from 7 to 7 for 7 days. I work 84 hours a week when I'm on. And when I'm off, I'm off. And then when I'm off, I'm out the country. I'm not even here. And so the week that I'm working like that, the sex might be the last thing on my mind. It isn't. But sex might be the last thing on my mind. And so scheduling intimacy, scheduling time for me to enjoy myself is really important to me on those weeks. And so I still have my date nights that week. I still go and see my friends and chat. I still go to brunches. I still do those things to get my oxytocin going, and for me to be happy and for me to be motivated to have sex. And so I think that's really important, that we have to remember to schedule those things. It sounds like unsexy, but there's nothing more important to me than, having a crazy tough week and knowing at the end of the week that I'm going to go on a, really cute date with a really fine man. I'm going out with fine shit, and we might, get a little active. There's nothing that's going to encourage me more in a week than that. So I think that's important to just to talk about, and I think that's going to be the final thing as far as actionable tips that we can do, because when you do the sleep and you get the levels and you do the exercise and you eat well and you take your supplements and you make it a priority in your life, there's no way that you cannot win sexually. There's no way that you cannot win. Absolutely.
I like that. So we have been closing most episodes, if I remember, with a magic tip. And it's outside of what you just said, but it's actually from each of our experiences. And I call it the aha moment. And I was trying to think of something for myself, because we are the magic of metabolic health, right? So what have I learned that's been magical or mind-blowing around my sexual health over the years, right? I think, the first thing that came to my mind, I'm going to tell you. So, Funmmy, we talked about toys earlier. We haven't shared our toys yet. We're not going to show all of them. We're going to show one each. You show yours, I'll show mine.
I don't have a lot. I don't have a lot, but what I do know is that, remember when that show Scandal came out, and Olivia Pope, she's literally one of my favorite characters of all times. She would have like a full on, her full on fit, and she had her coat on, and she would have like elbow length gloves, and she had this walk that was just so bad. And I swear to you, after I watched that show, I was absolutely obsessed. So I did in fact go and get like full length gloves, and I've been wearing it with my coats. When I wear it with my coats, especially now it's October, it's getting cold in New York, and I promise you, when I wear these things, I don't know. I don't know. It does something for me. It definitely does something for me. But then if you pair it up with the fact that I'm also an equestrian and I've been, learning how to ride horses and everything like that, then I have my whip.
Oh, yes,
and
you
then
do.
I'm like just a deadly combo out there. I'm like, they're like, where is this woman going? And I'm like, you'll never know.
You never know. I don't even know till she's there or gone. I know. I know that much. Wow, that's amazing. Okay, that's going to be our title slide probably for this episode.
Yeah, just come in like, oh, you'll never know.
Yeah, right. So, okay. Well, I guess we're sharing our magic of sexual health, like all out, right? Go big or go home. So
let's go.
I have a paddle.
Oh,
I have a little paddle here. I'd like to let y'all know that it's either leather or pleather, but it's it's solid. But on the other side, it's lined with satin, silver satin, and it has a little like cushion inside, so it's a little bit softer. This is more like your what did you call it? Whip or something? What do you call your equestrian tool?
It's technically
like a tool.
My God, don't you start with me. Don't you start with me.
I've been learning to ride horses. I know what equestrian means. I took like 10 horseback riding lessons over the summer.
Did you really? I did not know that about you, darling. This is why, I've always been like, I'm always like, anytime I'm on vacation, I'm always looking for, to do some do some horseback riding lessons and like go to the stables and watch them and everything like that. I'm absolutely in love with it. Yeah. And I'm looking forward to like maybe, purchasing my first horse maybe next year. So like, I'm God for it.
I guess I didn't know that. It's so hard to catch up on all these things. Every time we meet, we have so much to talk about. And that's amazing that we're both equestrian enthusiasts, or we are equestrians. Is that what?
Whip enthusiasts, apparently. Contact sports enthusiasts? I don't know.
So there's the magic, folks. We gave you all of our magic today, and then some. So
I know that's right.
I hope you're grateful, because I am. This was such a good episode.
Yeah, it was fun. I'm glad that we really talked about it because, like I said, I want to live in a world where people are having healthy sex. I want to live in a world where people, can really enjoy their yums and, and if we can help you get there, we'll definitely will. Look down for our resources, our toolkits. And like, if you have any questions, let us know. It's been lovely having you guys.
Yeah. Thanks, Dr. Funmmy. So yeah, we're going to wrap it up. My name's Amelia Wood, and this is Dr. Funmmy Awoyomi. We are the magic of metabolic health, and thank you.
We're bringing healthy back. Them other bros don't know about the facts.